I've been in Logansport for about 22 years now. Came here right out of residency. I had done college at Florida State University and then went to medical school at the University of Florida. And then I came up to Indiana University for my surgery training because I was basically told that it was a really good surgery training program, which it was. And then 5 years in Indianapolis doing my surgery training, and then came up to Logansport. What had happened was I married me a Hoosier. And then that kind of made a decision about where it was I was going to practice. I had grown up in a fairly small town in Pennsylvania. Roberta had grown up in Greensburg, which is a small town down in southeastern Indiana. And so we were kind of looking for a smaller place to live and to practice and to raise our children, and settled on Logansport. In terms of being a general surgeon, a lot of it obviously is doing the operations. But if you looked at it time-wise, that's probably really the minority of the time. At least 2 days a week I spend over in the office seeing patients either before their surgeries or after their surgeries, trying to decide, do they need surgery in the first place? If so, what kind of surgery? And then taking care of them recovering from their operations. A lot of the patients who maybe have more of a chronic problem, cancer or something like that, I'll see in the office sometimes for years, just making sure that they're continuing to recover properly from whatever operation they've had. So a couple of days a week over in the office, several days over here in the hospital doing procedures, either operations or we do a lot of endoscopy, colonoscopies, gastroscopies, bronchoscopies, different scopes looking at different things and trying to either diagnose or correct whatever abnormalities they might have. And then part of it is being available if either the primary care doctors need a consult on some patient up on the floor who maybe has a surgical issue, or if the emergency room needs some sort of a surgical help. I think the great thing about Logansport is it's a great size hospital. We're big enough to be able to do a lot of what people need, probably 95% of what people need. Now, not 100%, and we never will, and we shouldn't. If somebody needs a liver transplant, they should not have that in Logansport. If somebody needs a heart operation, that's best done in Indianapolis. But a lot of the things that people need, we are big enough to do. We're big enough to do just as well as the big Indianapolis hospitals do. And yet we're small enough that I think we can provide kind of more personalized care. We know a lot of the patients. The nurses know the patients. The families know the nurses. It's just, we're big enough to accomplish things, but we're still small enough to be personal and to know people. From a professional standpoint, I think that we have over the last 22 years, and if you go back to Gary Miller and Fred Hillis since 1975, I think we have provided better surgical care in Logansport than most communities this size. And being part of that tradition and being part of that continuity, I'm very proud of.